Good evening, everybody, and welcome to our joint briefing on COVID-19. My name's Sam Crowe, and I'm the Director of Public Health across Dorset and BCP Councils. And I'm delighted to be joined tonight by Aidan Dunn, who's the Executive Director for Corporate Development at Dorset Council, and Councillor Nicola Green, who's the Cabinet Member for COVID Resilience and Public Health, BCP Council. We're going to be talking to you about the government's announcement on the new tier system and what this means for us in Dorset. We'll then go on to answer as many of the many questions that the public have sent in over the past few days as best we can. Now, you may have heard by now that both local authority areas have been placed in Tier 2. Could I have the next slide, please, Simon? Some of you might be feeling surprised or disappointed that we are in a higher level, but I want to put across some of the context around the reasons for that decision. Currently, there are only 3 areas in the whole of the country, the Isle of Wight, Cornwall and the Isle of Scilly, that have been placed in Tier 1. And as you can see on this slide, the government considers a range of measures, not just the headline case detection rates, but several measures that have been taken into account in how they've arrived at the decision for all councils throughout England. So as well as our overall infection rate, they look at the infection rate, particularly in people aged over 60, the impact that might be having on our care sector and our hospitals. They'll look at the rate at which cases are rising or falling, and also the positivity rate. So that's the proportion of people testing positive through our local testing. And above all, a really important factor is the pressure on the local NHS services. And that includes not just our current occupancy in our hospitals, but also projections about where that might be heading. Next slide, please. So what I wanted to show you tonight was just some of the background public health information that I hope will provide some context for where we are now, but also how we get through the next few weeks ahead. So what you're seeing on your screen at the moment are epidemic curves for the 2 council areas. They're broadly similar. The only difference between them is that the number of cases in the peak of the epidemic in the BCP Council area is roughly double the number of cases in the Dorset Council area. But the point about these slides is that you can see just how quickly the infection rate started to rise at the end of August, after both council areas had experienced extremely low rates over the summer. And just as it went up extremely quickly, you can see right on the right-hand side of the slides just how quickly cases have started to fall as we've had that national second lockdown, which has been pretty effective in reducing social mixing and limiting our infection rates. So currently, the infection rate in BCP Council is 138 cases per 100,000 and 64 cases per 100,000 in Dorset. But of concern is the infection rate in the over 60s. It's high, but it is coming down. It's currently 132 cases per 100,000. Next slide, please. And what I wanted to show you was just a couple of what we call heaps, just how quickly those infections can spread across the age group. So this is showing the infection rate over the past few days, but split through age bands. So the darkest age band here is the 16 to 29-year-old age group, which is driving our local transmission. The infection rates are much higher in that age group and have been for several weeks. But of concern is how quickly that can spread into older age groups and above all, the over 60s. And if that happens, of course, because of the severity of COVID in that age group and the risk of more serious disease, that's what feeds into our hospital system and starts to create pressure for our services, but above all, more serious disease for those people. Next slide, please. So the heat maps are fairly similar across both councils, and the important thing to note is that the infection rates in all ages have started to come down in the past few days, and we hope that trend continues. Next slide, please. So just a few notes from me on our local transmission situation. As I said, it's being driven by higher infection rates in younger age groups, but because most spread is within and between households, it's quite easy to see how that infection can spread to older age groups. So one of the key things that we must do is to try to limit our social contact as much as possible. As hard as that is, we have to do all we can to protect COVID from spreading into older age groups. We still have higher infection rates than we would like, and although rates are coming down, it's really important that as we come out of lockdown, we do continue to observe social distancing as much as possible, Remember the importance of hand hygiene because of surface contamination and transmission, and above all, continue to wear face coverings in enclosed public spaces. And although our testing and contact tracing service is certainly improving, and we don't see huge difficulties with it in Dorset and BCP Council, it still remains that limiting social contact is by far the most effective tool that we have for lowering infection rates. And you can see that quite clearly, given the epidemic curves that I showed you, just how quickly case rates come down if we stop mixing between households. I'd now like to show you the main measures under Tier 2, which both councils have been placed into. The really important point about Tier 2, and I appreciate that some of that writing is quite small, you may not be able to see the detail, but the most important point is that you cannot mix households in any indoor setting in Tier 2, and that includes pubs and restaurants. So although you can visit a pub or a restaurant for a substantial meal, you must do so within your own household and/or support bubble. You cannot go in larger groups. I'd now like to hand over to Aidan Dunn from Dorset Council, who'll talk more about our joint response to COVID and how councils are supporting local communities.
Excellent. Thank you very much for that introduction and explanation there, Sam. Now, one of the questions that we've been receiving all afternoon since the announcement of Tier 2 was why is Dorset Council and the BCP area, why are they both in Tier 2, especially when the case rates differ so significantly, as Sam's just explained. So it's really important to understand that the case rate is not the only factor that the government has considered when assigning areas to tiers. One of the really important factors is about local context, and it's really important that we remind ourselves that there are large numbers of people that travel between the two council areas for things like work and education, so the two areas are very much linked. Now, although there are two unitary authorities for the whole of Dorset, we are very much working closely together to support our communities. We are part of a group called the Local Resilience Forum, which includes both councils, health, police, fire, ambulance, and all the other agencies. And whenever a major incident occurs, such as coronavirus, our goal is to work together to protect people and keep those essential services going and offer support at time of crisis. And indeed, we've been working together throughout the coronavirus period. So throughout the pandemic, both Dorset Council and BCP Council have been supporting residents that need our help. We've been doing things such as collecting prescriptions, delivering food shopping, dog walking, or indeed providing someone to talk to. Both councils have worked with local volunteers to help the most vulnerable. Now, if we move on to the next slide, I can give you some information there on the slide. If you do need help, you can call the following contacts. So if you're a Dorset Council resident, if you dial on the left there, 01305 221 000, and if you need help and support as a Bournemouth Christchurch Pool resident, on the right hand side, 0300 123 7052. So that's how we're supporting vulnerable groups. But if we move on to the next slide, I want to talk about how the pandemic continues to have a major impact on people's lives and in particular their livelihoods. More people every day are becoming increasingly worried about paying bills, about the potential of redundancy, about reduced working hours, keeping their home, and what the long-term impacts of the pandemic may be on their finances. So part of both councils' commitment to support people to live safe and independent lives, and indeed to help prevent homelessness, both Dorset Council and BCP have set up dedicated helplines and information for local people to access support with managing their money worries. Dorset Council's scheme is called Reaching Out, and BCP's scheme is called Let's Talk Money. So if you are worried about your finances and you live in the Bournemouth Christchurch Pool area, the number to call is 01202 985 104. And if you live in the Dorset Council area, the number on the left there, 0800 144 8848. So some helpful information there for residents, I hope. Now, I'd like to hand over to Councillor Nicola Green from BCP Council, who's going to talk to us about the local economy. Nicola. Nicola, are you on mute?
Well, that's a fine start, and you can see why I'm not the Cabinet Member for Technology. Apologies to everybody. Aidan, thank you very much for the prompt. Good evening, everyone. After today's announcements, there are some good news about what we can do. We can meet in small groups outside in public. We can go for dinner with our household in a restaurant or a pub serving food. We can go to the gym, and yes, we can get our hair done. But the restrictions continue, and we all have a role to play in helping everyone to understand and follow the rules. The economic impact of COVID-19 continues to be a real issue for local businesses and for the livelihoods of many residents. We're currently allocating the local restriction support grant. Almost 1,200 applications have already been processed, with nearly £2 million distributed to local companies in the BCP area. We know that there are some sectors who've been particularly badly hit by the cumulative impact of restrictions, such as our valued nighttime economy. There's an additional restriction support grant of 7.9 million, and we're looking at how we can help non-rate paying businesses and sectors in the most need of support in the longer term as we emerge from the pandemic. We'll be releasing details of that really soon. And details of the schemes will be available on both council websites. In the BCP area, we're running our Rediscover Safely campaign. Across our conurbation, we have a wealth of amazing independent retailers who've adapted really quickly to provide online sales, click and collect services, local deliveries and more. These shops will only survive if we continue to spend locally, and it's absolutely vital that we all show our support now by either choosing to search and shop online if you're required to isolate, or rediscover safely those premises that are able to reopen next week. And if you are a local premises, there are loads of posters and other assets available for you to use. You can download them free from our website. Now, residents across Dorset have done so well in the face of such adversity since March, and of course during the last few weeks of national restrictions. And it's really an opportunity to say thank you so much to everyone for sticking with it and doing your bit to help control and reduce the spread of the virus. Even as we have some restrictions lifted, it's important we continue to be really careful to protect ourselves and others. We all want to do the things we enjoy over the coming festive season, but we really must focus on getting there safely. The hands, face, space mantra we're all so familiar with must continue. Please try to limit your contacts with others, stay at home as much as you can, download that NHS Taste and Trace app if you haven't already. Isolate if you're requested via Test and Trace, and get tested if you have symptoms. And keep your children off school if they have symptoms, or if indeed you're waiting for your own results. Please continue to protect our older people. Much as we want to see our parents and grandparents, this age group is so much more vulnerable. So if you can bear with it just a little bit longer before you see your older family members in person. Together we can go forward, not back in terms of our infection rates and our way of life. Environmental health officers, trading standard officers and COVID marshals, supported by Dorset Police where necessary, will continue to follow an approach that places emphasis on engaging with businesses, premises and individuals. The priority is to help businesses and people understand and follow the rules, and enforcement is only ever a last resort in response to breaches. The nighttime economy is expected to be a focus. Much as we all want to head out for a drink or a meal, please follow the rules and take care wherever you are in our country. So that's it for me, so I'll hand back to Sam.
Sam, you're on mute, I'm afraid.
Thank you, Aidan, and thank you, Councillor Green. We're now going to head over to our question and answer session, and I'd just like to thank everyone who's taken the time to send a question in today. We will do our best to answer as many as we can, and unsurprisingly, lots of people have asked very similar questions, so we've grouped those together and drawn out the main themes, so hopefully that will answer your query. We'll be publishing the questions and answers on our website, and we'll be responding direct to people who ask very specific questions, particularly where that relates to their own individual circumstances. So without further ado, let's make a start. And I'm going to start with question 1, please. And this is a question about how is the decision made around which tier we've been placed in, and how will that be reviewed? So this one's for me to answer first of all. And as I outlined earlier on in the session, in the winter plan published by government on Tuesday, those 5 criteria that I discussed set out the measures that are assessed when government's looking at each council area to determine what the local measures should be. And as I said, it's not just the headline case detection rate. What's important is the infection rates in older age groups and the impact on the care sector. We're also looking at the rate at which cases rise or fall. I mentioned the positivity test of our testing services, and pressure on the local NHS, including not just the current bed occupancy, but the direction of travel. The second question I'm going to ask Aidan Dunn to respond to. Why is Dorset Council in the same tier as Bournemouth, Christchurch and Poole when case rates are lower?
Yeah, thanks, Sam. And as I sort of touched on in my introductory remarks, and as you've just said, it's these setting of these tiers is determined by government. It's not a negotiation. So the government has set them based on scientific advice and based on those criteria that you've described earlier. We've not been able to input into this decision. So the leader of Dorset Council, Spencer Flower, has said he has expressed real disappointment that Dorset Council is in tier 2 rather than tier 1. We really did have the ambition to be in tier 1 when a lockdown came. The rate of COVID infection is falling. It is one of the lowest in the country within the Dorset Council area. And we're hoping that if that trend continues and if everyone plays their part, then this will happen. So we're working with Bournemouth, Christchurch and Poole. I mentioned earlier how interconnected we are in terms of our residents. So if the trends continue, we're really hoping that come the 16th of December, when the tiers are reviewed, we're hoping that tier 1 might be a possibility. Thank you, Sam.
Great, thanks very much, Aidan. So moving on to question 2, and this is a question about the holiday period. So if we can have the next slide, please. The question is, how will the Christmas bubble arrangements work? And that's for Nicola Green.
Yes, got the microphone this time. Thank you. Thank you, Sam, for the questions. I'm afraid I can't see the word Christmas bubble without thinking over Christmas bauble, and clearly the two things are different, but they're both crucial to us this Christmas. So the government is changing some of the restrictions on social contact for a short period of time, from the 23rd to the 27th of December, so that people will be able to spend time with friends and family as part of a Christmas bubble. It's been a really tough year for many people, and we know just how important it is for everyone who can to see their loved ones at Christmas. It really impacts on everybody's well-being. So does it have to be exclusive? Yes, your Christmas bubble really does have to be exclusive. It can be made up of people from no more than 3 households, and you can only be in one Christmas bubble and you cannot change that bubble. Can I meet anyone who isn't part of that bubble over Christmas? No. Between the 23rd and the 27th of December, you mustn't meet friends or family in your home unless they're part of your Christmas bubble. You can continue to meet people who aren't in the bubble outside your home, according to the rules of the tier you're staying in. Can I travel to or have visitors from other parts of the country? You can. If you travel between tiers and indeed between the UK nations for the purpose of meeting your Christmas bubble, you should travel between the 23rd and the 27th of December.
Great, thanks very much, Nicola. So the next question, how can people celebrate Christmas safely when COVID-19 is still circulating in our communities, I think is obviously a question many people will be thinking about. And this is one for me. I think providing people are sensible and we remember the basic public health measures, then it will be possible to enjoy Christmas safely. So I mentioned before when I was going through some of the public health data in the context, that importance of household transmission. So even when we're thinking about the bubbles that we're likely to be in over the Christmas period, it's still important to remember the basic messages around washing your hands, watching your space and covering your face in indoor public areas. But above all, we need to sort of trust people to use common sense over the Christmas period. Don't bend the rules too much. We know that because of the importance of household transmission, it's really important that we take extra care. It might not be quite the same Christmas or holiday that we've enjoyed in the past, but I think with some adjustments, it can be enjoyed safely. And above all, if we're not careful over the holiday period, then it's likely that we may pay for it further down the road, and I'm sure we don't want that. And I think that lends itself to the next question, which is, do you expect the relaxation of rules over Christmas to cause an increase in cases, hospitalisations and deaths locally? Well, let's hope not. I think that because of the small window, the relatively small period when we're allowed to mix within our Christmas bubble, hopefully that limits the degree of social mixing in our population. But having said that, the virus is capable of being transmitted when we increase the level of social mixing. And the big difference this time around in winter is that it is not like the summer when levels of the virus circulating in the community were very, very low. We still do have rates of COVID in the community that are higher than over the summer period. So if we mix more socially, then it does increase the risk of the virus circulating. If we stick to the rules, if you remember the basic public health measures, then hopefully we can limit that rise in cases. And it's even more reason to keep following those basic measures over the holiday period. We move on to the next question, please. So this is a question for Aidan, and this is asking which businesses will be able to open under the new tier restrictions and what support will be offered to those who are affected by the restrictions.
Thanks, Sam. So when we moved to Tier 2 very early Wednesday morning, under Tier 2, businesses and venues can continue to operate in a COVID secure manner other than those which remain closed by law, such as nightclubs. Now, pubs and bars must be closed unless they're operating as restaurants, and so these restrictions will have knock-on effects for some other businesses as well, for example, those that supply pubs and bars. Now that we know that we're moving to Tier 2, we will be, as a council, as both councils, will be reviewing the impact this is having on local businesses and seeing what we can do to support them. So a message from both Dorset Council and BCP Council is that if your business has been impacted by the current lockdown, you can apply for financial support. So if you've been closed since the 5th of November due to the current national restrictions, you may be eligible for what's called the Local Restrictions Support Grant, the LRSG. Now, so far in Dorset Council and Dorset Council alone, we've received over 2,700 claims, and we're well through processing over 1,500 of them, paying out £2.4 million. Now, this is on top. This is for the latest lockdown. Just sort of to give it a sense of context, for lockdown 1, Dorset Council paid out over £107 million of government funding, passing it on to the retail, hospitality and leisure sector. So I realise it may not be as much as local businesses need, but it's definitely, there's an element of support there. So if your business was forced to close down during the current lockdown, but you don't pay business rates, because there are very detailed criteria, you may be eligible for financial support through a new grant scheme that's launching called the Additional Restrictions Grant. Now, this particular grant supports businesses that do not have to close, but have been significantly impacted. Now, in the Dorset Council area, we're going live with that grant tomorrow, that's Friday, and so there'll be details on the business pages of our council website. And for BCP, they went live with this grant a few days ago. So once again, look on the BCP website on the business pages, and you'll see information of eligibility, of whether you can apply, and if so, how to apply. Thank you, Sam.
Great, thanks very much, Aidan. So next question is about coronavirus cases, and I beg your pardon. So this is one on how will the new restrictions, including the Christmas bubbles, be enforced, and that's for Nicola Green.
Thank you, Sam. This is a similar answer actually to one that I gave a little while ago as we were moving into lockdown, but it's really worth, I think, reviewing it in the light of the bubbles. So we will have environmental health officers and trading standards officers, along with the COVID marshals, who are supported by the police where necessary. And they'll continue to follow an approach that places an emphasis on engaging with businesses, premises and individuals. The priority is to help people and premises to understand and follow the rules, and enforcement is only ever a last resort in response to breaches. Just as we've done previously, the council and the police will work together to make sure people understand the rules and are acting responsibly. Dorset Police is responsible for enforcing the law and will take appropriate action where people are not complying with legislation. The council is responsible for issues relating to antisocial behaviour and trading standards, and also provides that team of COVID marshals who work alongside the police and other agencies to provide a visible presence in priority areas, and that can be shopping areas or hospitality perhaps later on in the evening. They can also help businesses and residents by signposting them to guidance and can refer to regulatory agencies if that's needed. If people have any concerns about others breaching the new restrictions, they can contact Dorset Police, who will consider the most appropriate response and target problematic behaviour. To limit the number of calls on the 999 and 101 systems, if you can, try and use the online reporting at the Dorset Police website wherever possible.
Thank you very much, Nicola. Now, I think the next question is the one about local coronavirus cases. The question is, how can you find out more about cases in my area so I can assess my risk? So this one's for me. I think one of the improvements that we've seen through the pandemic is the provision of information, both at a national and a local level. So I think the first place to look is the Public Health Dorset website. Every Thursday there is a publication on the COVID-19 pages that sets out the case rates across both councils, not only in terms of the number of cases per 100,000 population, but also the actual number of cases, so you can get a feel for just how many diagnoses there've been in the past 7 days. The second place to look, if you're interested in data at a more local level, is that the government now produces coronavirus data on a daily basis on a mapping tool, which you can access from the www.gov.uk website. So if you go on and Google coronavirus data England, you will be taken to the main data pages on the government website. If you look for the link that takes you to the map, there's an interactive map there which you can scale, you can zoom in on your local area, and there's a key which will show you exactly how many cases there have been at a very, very small area level over the past 3 or 4 days. Now, that's not quite the only piece of information that you need to assess your risk. It will give you an indication of how many cases have been recorded in your area, but it's worthwhile just remembering that sometimes you may see those spikes in a local area which look concerning on the face of it, but it could be, for example, that you have a care home or you have another setting which has had a significant outbreak of coronavirus, with several cases linked to that. So it's not necessarily showing what's happening on in your neighbourhood and on your streets. Above all, I guess my final message is that, just remember those things that you can do personally to limit your own risk, and that's sticking to those basic public health measures. If you have the next question up, please. And so this one is for Nicola, and the question is, how are local authorities working with national government to ensure the right decisions are made for our area?
Thank you, Sam. Well, closely. We work closely with national government to make sure that the right decisions are made for local residents. Both councils, together with local NHS organisations and Public Health Dorset, provide up-to-date data, as Sam's just been referring to government to inform their decision making. For example, decisions about tier restrictions. We also hold regular briefings with our members of Parliament. One thing which is different this time around is that the rules which are to come into force next week are set for 2 weeks, and they'll be reviewed by ministers each week thereafter. And we will continue to stay in touch with our residents via the usual channels as we have any more news. Thank you.
Great, thank you, Nicola. So the next question is about our local hospitals, and the question is, how are the hospitals across Dorset currently impacted by COVID-19, and are there any plans to increase capacity if it is needed? So this one's for me to respond to, and I think obviously there are several points I'd like to make under this question. Our hospitals have seen an increase in COVID-19 patients, but the context at the moment is different to the early phase of the pandemic. So back in the spring, when we were first hit with that first wave of COVID cases, the hospitals were able to very quickly discharge patients, clear the hospitals, and increase the capacity of the hospitals to cope with the expected numbers of cases. Second time around, that situation's not quite so straightforward. The NHS has been trying its best to catch up with all of that work, the non-COVID procedures that were delayed during the early part of the pandemic, and they've done very well. So as they've stood up those services and they've tried to get people back into hospital for that essential care, that's obviously meant that we've had to go through quite a delicate balancing act to juggle that capacity. So the first thing to say about COVID is that because of the social distancing required within the hospitals, that's the first issue that sort of reduces our overall bed capacity. Because of the increase in hospital patients with COVID-19 that we've seen in recent weeks, that obviously puts further pressures on the hospital system. But it's not just the hospital system, it's also the wider parts of the health and care system that need to be able to respond, take people being discharged from hospital, and to keep patients moving through so that we can achieve that balance. That balancing act is very carefully considered. There are very, very careful plans being put together by the system, but the understanding at the moment is that there wouldn't be plans to stand up additional capacity such as Nightingale hospitals. You may have read that there are plans to bring forward a Nightingale hospital in Exeter. That is not currently the plan in Dorset. So the answer is that the hospitals are under pressure. We do have more patients affected by COVID-19 at the moment, but we are doing our best as a system to shift our resources and to deliver that extra capacity from within our system. The positive news is that our infection rates are falling. So as I said right at the beginning of the session, the rate in BCP Council has come down significantly, and in Dorset Council, it's been about a 38% drop in COVID cases over the past 7 days. And we should expect that to feed through into fewer people in the hospital system over the next few weeks. So if we all continue to play our part, I'm hopeful that as those infection rates fall, we should continue to have enough capacity to cope with the second wave. We can move on to question 8, please. And this is one for Aidan. And Aidan, what is the advice for people who are clinically extremely vulnerable, and what support's available?
Yeah, thanks, Sam. So clinically extremely vulnerable. So this refers to the shielding programme. You might remember that the original national shielding programme was introduced during the first lockdown, and it was very, very restrictive indeed. And that was paused, and less restrictive guidelines came into effect for the second lockdown that we are now in. Now, as the tiers were announced today, and we move into the tier 2 on Wednesday, just as we started this broadcast, the Department of Health uploaded its guidance on shielding and protecting people who are clinically extremely vulnerable, and details of that guidance are now available on the .gov website. So I'd certainly refer people there. I mean, just very, very simply, the advice or the summary of the advice is please limit your social, if you are clinically vulnerable, limit your social interactions as much as possible. Now, there's also there's indication that those who are identified as clinically extremely vulnerable will be contacted by the NHS over the coming days as well. But Sam, I think it's just a quick opportunity to say a little bit more about what both councils have been doing to support these the clinically vulnerable during this time. So we've been focused on making sure that people have everything they need. We've been putting people in touch with community and voluntary organisations who can help them access food, medicine deliveries, befriending services, that sort of thing. So if anybody who needs help but doesn't have the support network of family, friends or neighbours, then they can, in the Dorset Council area, they can contact the Dorset Together helpline on 01305 221 000. So that operates Monday to Friday, 8:30 till 5:30 p.m. Although there is out of hours as an online form available as well, dorsetcouncil.gov.uk coronavirus. And similar service in the Bournemouth Christchurch Poole area. If people are in need of help, they can call the Together We Can helpline on 0300 123 7052. And once again, they can go online, bcpcouncil.gov.uk, Together We Can. So I think the councils are doing, have got some helpful services there, and the clinically vulnerable certainly haven't been forgotten as we enter into Tier 2. Back to you, Sam.
Thank you very much, Aidan. So moving on to the next question, which I believe is the final question of the night. And the question is about the COVID-19 vaccines that are on their way. What is being done to prepare for the rollout of a COVID-19 vaccine in the county prioritised? And the second part of the question is, how do we know that the vaccine is safe when it's been developed so quickly? Both good questions. So I'll take that. It is great news. They do look as if they should be here pretty quickly. But in the background, NHS colleagues that have been leading on the delivery of the Max vaccination programme have been working really, really hard to make sure that the delivery model is ready for as soon as those vaccines are authorised and they start to hit Dorset, services are ready to go to make sure that they can start to roll them out. The key issue at the moment is that they will be rolled out in priority order. So there will be some NHS workers that will be receiving their vaccine from the trusts. But in terms of our residents, the priority will be on the most vulnerable in our communities. So the first group that's likely to be immunised will be the over 80s residents in the care sector, followed by the sort of increasing or decreasing age groups, as it were, in priority order. So we'll start with people aged over the age of 80, and as more vaccine arrives, that will be progressively rolled out to younger age groups in turn. The second part of the question, how do we know that the vaccine is safe when it's been developed so quickly? Although the delivery of the vaccine, the development has been accelerated out of necessity, it's still the case that it has to go through very, very rigorous evaluation. So all of the vaccines have to go through the sort of standard three-phase process of demonstrating that not only do they work, but that they're also safe. And that safety data has to be published in full. It will be pored over by the Medicines and Healthcare Regulatory Authority. That is the independent body that's responsible for the green light, as it were, to use those vaccines in this country. So as soon as the data's in from the trials and the MHRA has satisfied itself that the vaccine's safe, that's the sign off to then lay the legislation before Parliament, which will enable the vaccines to be used. So we should trust in the process. It's exactly the same process that's used to license other pharmaceuticals. Although it's being sped up and accelerated, I'm pretty confident that the same diligence is being shown when it comes to that data. And transparency is a really important part of that. So those large trials will be published in the journals in the usual way, and peer reviewed by a number of experts. So that brings us to the end of the questions tonight. I'd like to thank the public for your interest in the briefing tonight and for sending in all those excellent questions. I'd also like to thank our panel members for their time given to the briefing tonight, Aidan Dunn and Nicola Green from Dorset Council and BCP Council. I'd also like to thank the team that have worked behind the scenes to help put this together. Have done an amazing job tonight. And I'd just like to, if we could have the final slide, please, just to remind people that a full recording of the session will be available from tonight. It will be available on YouTube, either the Public Health Dorset channel, BCP Council channel, or the Dorset Council channel. And if you want to stay up to date, then please do follow Dorset Council on Facebook or Twitter, or search for Healthy Dorset, which is the Public Health Dorset channel, BCP Council or Dorset Council UK. So thanks ever so much again. Please do stay safe. Remember those basic messages of hands, face and space. I hope that you do enjoy the holiday period, and if we all continue to work together, let's continue to do all we can to keep those infection rates down and hopefully get to that review period as soon as possible. Stay safe. Thank you.